Yeah, hello, my name is Brosch. I'm a postdoc in the lab from Jochen Hampe, and we are experts in functional genomics.
Hello, my name is Marco. I'm from patient organization. It's really nice to have you here. So what exactly are you doing in the lab?
What we are doing in the lab is we are trying to find out the gene expression or genetic patterns which lead to a disease, to identify some targets which might be useful in therapy or early detection of a disease state.
Is that a difficult thing to do?
In the end, it was. Now the technology developed. It depends certainly on the samples we get from the surgical departments. If they are in a good quality, we can certainly handle them very well. And our approaches certainly are sophisticated. They need a lot of, they are, sorry.
Yeah, no problem. No problem. So we will cut this up.
Okay.
So yes, I just want to ask you, how do you do that? You work with patients, or you work with samples, or you work with data?
Working, what we are acquiring in our work packages is it's a highly sophisticated. From my end, it's leading technology in gene expression analysis, and also from Sarah Fenn from the VIB in Leuven, it's end-of-the-edge technology in spatial metabolomics. Years ago, we were only able to measure the gene expression in a cube of tissue, also the metabolomics, and now we are able to cut the tissue and see in which part of the tissue the gene is expressed, and can now, hopefully with the help from Aurélien Derrien from the University of Paris, to integrate this metabolomic data from which we know which metabolite is in which part of the tumor, to integrate it with our transcriptomic data to get a better idea of what's happening in the tumor or in a diseased tissue.
But this means what? This is important for the researchers or doctors to know what is going on, or are there any benefits for the patients? Or?
We wouldn't do it if there wouldn't be a benefit for our patients. Yes, certainly. If we can identify a specific metabolite or a specific pathway which leads to a metabolite, if we see some genes are switched on which lead to a specific metabolite in the tissue, then we can either use this metabolite in a labeling approach for early detection of a tumor or early detection of the disease, or we can even maybe check for the signal pathway which is higher expressed, which leads in the end to this metabolite, to have an idea or have an early marker for this disease, or maybe we can also attack this signaling pathway, this dysregulated signaling pathway with a metabolic driven drug or something to get a therapy approach.
Thank you very much. That was super interesting.